Diarrhea is a major problem in countries like India. Mediums. When it comes to dealing with diarrhea, especially in countries like India and Pakistan where contaminated water is a big problem, it's important to take a thorough approach. This means understanding the illnesses caused by contaminated water, finding effective ways to treat diarrhea, and taking preventive measures to avoid it in the first place. Waterborne illnesses are diseases that are caused by the consumption or exposure to contaminated water. These illnesses can be caused by various types of pathogens, such as bacteria, viruses, and parasites that contaminate the water sources. One of the main reasons for diarrhea in areas with unclean water is the presence of harmful microorganisms like bacteria, such as E. coli and cholera, viruses like norovirus and rotavirus, and parasites such as Giardia. Usually these harmful microorganisms are spread through water that has been contaminated with waste material. Symptoms of this condition can go beyond just having frequent loose stools. You may also experience abdominal cramps, feelings of nausea, vomiting, fever, and dehydration. Here are some examples of different treatment options that you might consider. Medication. One common treatment approach is to prescribe medication to help manage symptoms and improve overall well-being. Anti-diarrheal medications, loperamide, Imodium, slows down gut movement and increases the absorption of fluids and electrolytes. Useful for symptomatic relief of acute diarrhea, bismuth subsalicylate, Pepto-Bismol, can reduce the frequency of stools and ease symptoms like abdominal cramping. Antibiotics are used for bacterial causes of diarrhea. Their use should be based on the specific type of bacteria identified or strongly suspected. Ciprofloxacin, often used for traveler's diarrhea and certain bacterial infections like E. coli. Azithromycin, preferred for its effectiveness against a broad range of bacteria and often used in areas with a high rate of antibiotic resistance. Rifaximin, a non-absorbable antibiotic used specifically for traveler's diarrhea caused by non-invasive strains of E. coli. Antiparasitic medications for diarrhea caused by parasites. Specific antiparasitic medications are used. Metronidazole, Flagyl, effective against giardiasis and other parasitic infections. Albendazole, used to treat a variety of worm infestations. Antiprotozoal medications, these are used to treat diarrhea caused by protozoa. Tinidazole, similar to metronidazole, effective against giardia and other protozoan infections. Nitazoxanide, used for cryptosporidium and giardia infections. Important considerations. The specific choice of medication depends on the suspected or confirmed cause of the diarrhea. Some infections, like those caused by certain viruses, do not require antibiotic treatment and are self-limiting. Overuse or misuse of antibiotics and antiparasitics can lead to resistance, making them ineffective for future treatments. Hydration and electrolyte balance are crucial in all cases of diarrhea, regardless of the underlying cause. Oral rehydration solutions, ORS, are a combination of clean water, salts, and sugar. ORS is a solution that helps replenish the fluids and electrolytes that are lost when you have diarrhea. Zinc supplements are really helpful for keeping our immune system strong and can even help shorten the duration of diarrhea episodes. Antibiotics are sometimes needed when dealing with bacterial infections. However, it is important to note that these substances should only be used under the guidance and supervision of a medical professional. One way to make dietary adjustments is by incorporating bland foods into your meals. For example, you can try eating foods like rice, bananas, and toast, as they are known to be gentle on the stomach and can provide relief. It's best to steer clear of dairy products, caffeine, alcohol, and spicy foods while you're recovering. Here are some precautions to keep in mind. To ensure that the water you drink is safe, it's important to boil it for at least 1 minute. This process helps to eliminate the majority of harmful pathogens that may be present. You could also consider using water purification tablets or filters as an alternative. It's important to maintain good hygiene practices. Make sure to wash your hands thoroughly with soap and water, especially after using the bathroom and before handling food. When it comes to food safety, it's important to make sure that you cook your food thoroughly. It's also a good idea to avoid eating raw fruits and vegetables, unless you can peel and wash them with safe water. Vaccinations are really important, especially in places where diseases like cholera are common. They can provide a great level of protection against such illnesses. It's important to stay informed about any water and food safety advisories, especially when you're traveling. Knowing when to seek medical help is an important aspect of taking care of your health. There are certain situations where it is crucial to reach out to a healthcare professional for assistance. Here are some instances when seeking medical help is recommended. Severe or persistent symptoms. If you are experiencing severe or persistent diarrhea for more than a few days. Some signs that indicate severe dehydration include having a very dry mouth, feeling extremely thirsty, and experiencing little to no urination. Stools that are bloody or black in color. If you experience a high fever or severe abdominal pain, it's important to seek medical attention as soon as possible. These symptoms could indicate a serious underlying condition that requires professional evaluation and treatment. Don't hesitate to reach out to a healthcare provider for assistance. When it comes to dealing with diarrhea in areas where the water sources are contaminated, it's important to take a comprehensive approach. This includes providing immediate treatment, adopting preventive measures, and being aware of the risks that come with waterborne illnesses. It's really important to make sure you stay hydrated, keep up with good hygiene, and reach out to a doctor if you need to when dealing with health issues. These steps can really make a difference in how well you handle things.